Namaste. I am Dr. R.R.UNNITHAN, physician, THANGAM Hospital, PALAKKAD. I am going to discuss about the ancient healing methods as envisaged by the saints in treating heart diseases. I will be describing the marma points, the yogasanas, pranayama, mudras, swara yoga, and mention about the acupressure points, and finally yoga nidra. There are a lot of marma points in treating heart diseases. Of this, the important ones will be discussed. The first point is located in the sole of the foot. First, you have to locate the center of the heel. So also, the point in between the second and third toes in the sole of the foot, about here. So you, with the two thumbs, starting from the center of the heel, you press up towards this point. This point is between the second and third toes. It roughly about 3 finger breadths from the web between this side. You have to do like this. From the center of the heel, press like this. Press with the thumb and it end here. This is the first point. The next point is there is a dimple here in the front of the ankle joint. You trace the point from between the second and third toe and come to this point. This dimple is here. You place your left hand there and tap with the right hand 5 times. Again, from this point, draw a line. This comes here in the dimple. Place your left hand there and tap with the right hand 5 times. Stop. Next, marma point is in the chest on the left side. You know, if from the nipple 1 finger but down. This is the point of the nipple and 1 finger but down. You place your middle finger here on the nipple, index finger 1 finger but down. Then place the fingers of the right hand over this point and press like this. Again, press, then you find the nipple, place your middle finger there, then the forefinger 1 finger but below it, then place the fingers of your right hand over this and press like that. This is an important point. Next is, you know, there is the collarbone is here. At the end of the collarbone, where it touches the shoulder joint, there is a depression. You take 4 finger breadths below the point. This is the point. You place the right hand, 3 fingers, forefinger, middle finger and ring finger here, and press with the right hand like that. This is the way it is done. You do it 5 to 10 times. Next point is, this is the throat pit. See, you take 7 finger breaths from the throat pit. That will come to here, slightly to the left. This is the throat pit. You take 4, 3, 7, slightly to the left on the breastbone. You place your right thumb here and press it 10 to 15 times. This is another point. Then again, another point is from the throat pit, take 6 finger breaths on the center of this breastbone and again press with the thumb lightly. So there are 4 points on the chest. One is here, another here, then it is below the throat pit, one it is 7 finger breaths below, another is 6 finger breaths below. Then in the hand, you take from the ring finger and middle finger, you take 3 finger breaths, that is here. See, ring finger, middle finger, 3 finger breaths below this place. With the right hand, middle, ring finger and forefinger, press sideways like this. Again, 3 finger breaths from this point with the right 3 fingers, press sideways like this. Okay. Then again from this point 7 finger breaths, that will come here. This point also, this will come here. With the right thumb you press it up 10 to 15 times. From here, this point, 7 finger breaths, it comes approximately here. Press with the thumb upwards 10 to 15 times. Okay. Then the other point is in the angle of the mandible. This is the mandible, lower jaw. And see, just below it there is a depression. You press this area firmly with the thumb. Press firmly. This is the mandible, lower jaw. In the center below it, there is a depression. Press with the thumb upwards 10 to 15 times. Okay. Then the tip of the nose. Press the tip of the nose downwards like this from the thumb 10 to 15 times. This is another point. Then see, the eyes touches the nose, both sides. Press with the middle finger and thumb here and press a few times, 10 to 15 times. Then this point in between the eyebrows, you take clockwise rotation 5 to 10 times, then anti-clockwise. Right. Then the other point is from this hairline up, you have to make the hand like in a snake-like position. Place this point here in the hairline. Here it touches the scalp. So at this point, you move the 3 fingers sideways 10 to 15 times. Here the hairline is there, anterior hairline. You put the hand in a snake-like position. This point should come in the anterior hairline, placed in the scalp, and move sideways 10 to 15 times. Then the other point is in the neck. Just bend the neck. A bony prominence you can feel. Just below that, you rotate with your 3 fingers, right hand fingers, middle 3 fingers, clockwise, anti-clockwise. Okay. As you bend the neck, you see a prominence of the bone. Just below the bone, with the 3 fingers of the right hand, rotate clockwise, anti-clockwise. Okay. Then from the same point, 3 fingers below, put your finger 3 fingers here and down. Same place also you make clockwise and anti-clockwise 5 to 10 times. So these are the marma points. Then we come to the acupressure points, a brief mention. Left hand, see the nail bud. From here to here, you press these points with the thumb, so the maximum pressure. This is an important point in case of chest pain. Then in both hands, you see the crease here. In a line with the little finger, this place, in this crease, you press with the both sides you can press 10 to 15 times. Again, 1 finger but below. Again, press 10 to 15 times. Okay. So there are 3 points in the hands. Then the midpoint of the nipple in the center, that place also you just press. Midpoint of the nipple in the breastbone. Then as previously mentioned, you can see the bony prominence here. On the side of the bony prominence, 1 finger but on either side also you can press. This is also an acupressure point. From this bony prominence, 4 finger breadths below and 2 finger breadths sideways, both sides. Press with both thumbs. These are the acupressure points. Then comes yogasanas. So elderly people, it is very difficult to do the yogasanas after a heart attack or any heart related problems. So the better thing, what they can do is, the easy thing is shavasana. That can be learnt from a yoga master. Then the younger generation, people who are much younger, in their 40s or 50s, who have cardiac problems, in addition to shavasana, you can learn Pavanmuktasana series, Vajrasanas, Shashangasana, Yoga Mudra. These asanas can be learned, and that may be useful for cardiac health. Then pranayama can be learned by both elderly and young patients. In pranayama, it is anuloma viloma, which is very useful. And there is no retention, there should not be any retention of breath. What you do is sit erect. Spine should be straight, and you close one nostril with the thumb. Inhale slowly for the count of 4. Close the left nostril. Exhale slowly through the right nostril for the count of 8. Again inhale slowly through the count of 4 through the right nostril. Close the right nostril. And exhale slowly through the left nostril for the count of 8. This you can do for 5 to 10 minutes. Pranayamas is very useful for the lungs and the heart, and it will also calm your nervous system. Then is Ujjayi breathing. That is, you touch the palate with the tip of the tongue. Close the mouth and breathe in. There is a hissing noise. Again, touch the palate with the tip of the tongue and inhale through the nose and exhale through the nose slowly. You need not do the ratio of inhalation and exhalation. You can do as you like. Tip of the tongue, close the mouth. Then the other is primary pranayama. That is, you inhale and while exhaling, you close your mouth and mentally chant Om. Like this. Your whole body will vibrate and you will be relaxed. That is, you slowly inhale, then on exhaling chant Om, like this. Primary pranayama is useful in reducing the anxiety. There are so many mudras. Among the mudras, Abhanavayu mudra is the most important. This mudra helps in removing the breathlessness. It also increases the lung function. The mudra has to be done in both hands. First, place the tip of the forefinger on the root of the thumb. Then place the tip of the middle finger and ring finger on the tip of the thumb. The little finger should be free. This is the mudra. You have to do it in both sides. Minimum you have to keep the mudra for 45 minutes for the maximum benefit. At the time of heart attack and when anybody is experiencing chest pain, this mudra is very useful. While you are walking, you can use this mudra. Then breathlessness will be reduced. Fatigue will also be reduced. The next mudra is Vayu mudra. For this, you have to press the tip of the forefinger at the root of the thumb. Other fingers are to be kept straight. Do it on both sides. This is good for reducing the anxiety also. Next mudra is Apana mudra. Apana mudra is done by touching the tip of the thumb with the tips of middle finger or ring finger, like this. This is good for the heart and is also good for people with constipation. Next is Jnana mudra. For this, the tip of the thumb is touched with the tip of the forefinger, like this. This is used for meditation also. This is good for reducing the anxiety and relaxing the whole body. Next is Dhyana mudra. It is also relaxing mudra. The left hand is placed over the right hand, palm up. It is placed above the umbilicus or just at the level of the umbilicus. You can keep in this position for 40 to 45 minutes. It will also bring down the anxiety levels. Next is Ganesh mudra. For this, the left hand is kept like that and the fingers are folded, and the right hand is placed with the palm inwards, and pull the fingers apart together. This is good for the heart and also good for people with Parkinsonism. This is Ganesha mudra. Then there is another mudra, Rudra mudra. You place the tip of the ring finger and forefinger on the tip of the thumb, both sides. The middle finger and little finger are kept straight. This will bring energy to the whole body. Lastly, there is another mudra called There is another mudra called Uttarabodhi mudra. For this, You have to keep the four fingers like this, thumb like this, and place it over the solar plexus. This will energize the heart and the abdomen. So all these mudras, if you get time, you can practice. Then is swara yoga. Swara yoga is based on the breathing through both the nostrils, the nasal cycle of breathing. So if the left nostril corresponds to the ida and right nostril corresponds to the pingala. Roughly, the left nostril corresponds to the parasympathetic system and right nostril corresponds to the sympathetic system. In cardiac disorders, to reduce the heart rate, we utilize the left nostril. If we block the right nostril and breathe through the left nostrils, heart rate will come down, blood pressure will come down. So what we have to do is, you have seen the great saints using a rod, dant, the staff. Instead of that, you can place your hand on the right axilla, close the right nostril and breathe through the left nostril. This will bring down palpitation, increased sweating, anxiety level. This will definitely bring down the blood pressure also. Breathing through the closed right nostril, that will open the left nostril and is good for the heart. And people with high blood pressure and cardiac disorders preferably should lie down on the right side, right lateral position. That is, the left shoulder should be high, left nostril should be in the higher position. That is good for them. Then is manthras. You know, from ancient times, Mrityunjaya mantra and Dhanvantari mantra are used for healing. Apart from this, there is the Bija mantra of the chakras. The Anahata chakra is concerned with the heart. It is located roughly at the level of the nipple, in the central position, in the vertebral column, in the spinal cord. Anahata chakra is also called as heart chakra. You have to visualize a lotus with green petals and a cloudy center in the middle. Petals are green and smoky color in the center. And the mantra of Anahata chakra is Yam. You have to YAM. You have to chant the mantra as many times as possible. Yam, 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 yam. That is good for the heart chakra, and this in turn will affect the functioning of the heart. In addition to that, there is another mantra of Adi Shankaracharya. The mantra is HEEM, H-E-E-M. The Sanskrit mantra should be, you put the mantra here in the Sanskrit alphabet. Let it descend through the whole spine and you chant HEEM, 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 HEEM. That will give energy to the heart and energy to the whole body. The fatigue of cardiac patients will be gone. You have to do meditation. Most of the meditation techniques are difficult sometimes for the ordinary man. The simplest meditation is meditation on your own breath. For that, if possible, you can sit on the ground in the crossed leg position, or you can sit in a chair with feet touching the ground. Only thing is that the spine should be erect. Close your eyes. Breathe in and out slowly. Don't use forced breathing. Close your eyes and watch the breath as it moves in through the nostrils, the throat and into the lungs. During exhalation, you watch the breath going from the lungs, through the throat, through the nostrils to the outside. Take as much time as possible, possibly 5 to 10 minutes, and this will definitely give you relief from all the tension. Meanwhile, it was worthwhile remembering to have exposure to sunlight. If there is sunlight outside, preferably go there and sit there from 7 a.m. to 8 a.m. and enjoy the sunlight, face the sun. For those of you who can get direct sunlight, just close your eyes and you can stay in Surya Mudra. That is, the ring finger should touch the base of the thumb and then you hold the ring finger. This is the Surya Mudra. And as you close your eyes, turn your eyes towards the sun. As you inhale, let the sun's energy go through your center of the eyebrows into the back of the head and let it go to the umbilicus level at the vertebral column. As you exhale, see that the sun's energy is released from that center to the whole body. Once again, close your eyes, watch the sun, inhale, let the sun's energy goes through in between the eyebrows, through the back of the through the vertebral column and let it come to the level at the level of the umbilicus. It is called as Manipura Chakra or and from there on exhalation that the sun's energy diffuses throughout your whole body, and visualize the sun's energy entering your heart and rejuvenating your cells. You have to do affirmations every day, because when you are diagnosed with a block in your heart, or if you have a heart attack, you are always under tension. And when the next attack will come, you will always be afraid. So, to overcome that, you have to do affirmations before going to bed at night, and soon after awakening in the bed itself. You have to say, I am healthy, my heart is normal. Say as many times as possible. This will help in recovery and a healthy body and mind. And the last thing you have to be aware of is yoga nidra. It is called as psychic sleep. For this, you have to lie down on your bed, preferably on the ground, and you have to completely relax yourself. You should remove your eyeglasses, watch and other things, and the body should be loose. Feet should be held apart. Hands should be free on the floor. You close your eyes and take deep breaths. Inhale deeply and exhale deeply. You continue the deep breathing for 1 to 2 minutes. Then you have to have a resolve. The resolve should be simple. I want a healthy body and mind. Say it 3 times. Next, you have to become aware of the individual parts of the body. Close your eyes and you lie down on the floor, and first you become aware of your left thumb, left forefinger, then middle finger, ring finger, little finger, palm, left hand, left arm, and the right thumb, right forefinger, middle finger, ring finger, little finger, palm, hand, arm. Then bring your attention to the hip, thighs, knee joint, calf muscles, left leg, left foot, left big toe, second toe, third toe, fourth toe, little toe. Then right hip, right thighs, right knee joint, right calf muscle, right leg, right foot, right big toe, second toe, third toe, fourth toe, little toe. then lower back, middle of the back, upper back, shoulder muscles, back of the neck, back of the head, ears, scalp area, forehead, eyebrows, right eye, left eye, nose, cheek, mouth, jaws, front of the neck, chest. Be aware of the heart and the lungs. Then the upper part of abdomen, middle of the abdomen, lower part of the abdomen. Attention to be given to your hands resting on the floor, legs resting on the floor. Keep awareness of your two upper limbs resting on the floor, two lower limbs resting on the floor, and the back resting on the floor. Take deep breathing. Inhale deeply and exhale deeply. Now, as you inhale, see that the energy goes and come to the area in the vertebral column opposite the umbilicus, that is Manipura area. As you exhale, distributing all over the body. Continue to inhale and exhale. As you inhale, the energy comes in the area in the vertebral column opposite the umbilicus. As you exhale, the energy gets distributed to the whole of your body. Now imagine, as you inhale, golden colored energy comes into the Manipura area, that is the area in the vertebral column opposite the umbilicus. As you exhale, the golden energy comes to your heart. Slowly inhale and exhale. As you exhale, the golden energy enters each and every muscle of the heart, and it enters all the blood vessels distributed in the heart. As you continue to exhale, the golden energy removes all the blockages in the heart blood vessels. Arteries of the heart are cleaned, and all the blockages and plaques are gone. Feel the energy of the golden light. It cleanses whole your heart and rejuvenates all the blood vessels and heart muscles. All the cells of the heart are now vibrant with energy. Be in that bliss for 2 to 3 minutes. Slowly inhale and exhale. Now you should be aware of your breathing. Now you are aware of your body's position. You are aware of the sounds in the room. You are aware of the whole body. Slowly inhale and exhale 4 to 5 times. Now you are wide awake. All your illnesses are gone, and now you are having a healthy heart. So be positive in your approach to life. May God bless you all. Wish you a long and healthy, happy life. Namaste.